Namaskar. Greetings from Department of Gastroenterology, Sahyadri Super Speciality Hospital, Nasik. I am Dr. Dhaval Choksi, consultant gastroenterologist and hepatologist. Every year, 28th July is celebrated as World Hepatitis Day to raise awareness about viral hepatitis, which is a global public health concern of epidemic proportions. What is viral hepatitis? Viral hepatitis is inflammation or swelling of the liver caused by different types of liver specific viruses. These are hepatitis A virus, B virus, C virus, D virus and E virus. Let's see why this problem is so huge. Let's go through the facts and figures. As per the WHO 2022 data, there are more than 354 million people living with hepatitis B virus. 1% dies every 30 seconds because of viral hepatitis related illness. This accounts up to more than 1 million deaths per year, which is way more than the combined deaths of HIV and malaria put together. If you see Indian data, there are more than 40 million people affected with hepatitis B virus in India and around 10 to 12 million people affected with hepatitis C virus. These numbers are huge and hence this problem is so significant. Let us now see how do you identify a person who has got viral hepatitis. As I said, there are 5 major types of viruses. Of this, hepatitis A and E virus are the usual causes of acute hepatitis, that is short duration of hepatitis. When a patient develops acute viral hepatitis because of A or E virus, the patient develops symptoms like yellowish discoloration of eyes and urine, commonly we call it as jaundice, fever, pain in abdomen, decreased appetite, nausea and vomiting. This illness usually lasts for about 2 to 4 weeks. The hepatitis B and C virus are usually responsible for long-standing or chronic hepatitis, and this can eventually lead to end-stage liver disease called as liver cirrhosis or even liver cancer. These patients many a times can be asymptomatic, or they can also have symptoms like yellowish eyes, yellowish urine, swelling in both the feet, fluid collection in the abdomen, or blood vomitus, or sometimes blood in the stool. They can also have weight loss which is unexplained and loss of appetite. Sometimes patient does not have any of these symptoms, but this disease is picked up incidentally during a routine regular health checkup or while the patient is undergoing fitness for some other surgery. Having seen this, what are the symptoms? Let us now see what are the measures which can be taken so that viral hepatitis is prevented. As per the WHO's commitment, they have decided that they want to eliminate viral hepatitis by 2030. So with regards to this, there are certain measures which can be taken up at individual level and at the level of a society so that the viral hepatitis is prevented and this chain is broken. For hepatitis A and E virus, it is feco-orally transmitted, that is, it is food and waterborne disease. So the two most important prevention would be: 1, ensure that there is access to clean water and food, and number 2, adequate hand hygiene. So one should ensure that they are drinking clean water, clean food, and before ingesting, one needs to wash their hands with soap and water. If these two things are taken care of, viral hepatitis because of A and E virus can be substantially brought down. As far as hepatitis B is concerned, this is a vaccine preventable disease. The government of India under Universal Immunization Program covers all the children now with 3 doses of hepatitis B virus vaccine. Also, adults can avail of this facility. The vaccine is very cheap. It costs barely 100 rupees and 3 doses need to be taken. This is all the more important for people who have a family member who is hepatitis B positive. Also, pregnant ladies during their period of pregnancy should be checked for hepatitis B virus, because if it is positive, they can be treated during pregnancy if need be. At the same time, they can be identified and their newborn will be adequately vaccinated both with vaccine as well as immunoglobulin. Apart from this vaccine, there are certain measures which an individual can take to prevent this transmission of hepatitis and B and C, which would include avoiding contact with blood, avoiding unprotected sexual intercourse, ensuring that if somebody is getting a tattoo done, it is done from a reputable place. Patients who are on hemodialysis are again at very high risk of hepatitis B and C virus, so they should also be periodically checked. With this, I come to the end and let me share the World Hepatitis Day 2023 theme with you. It is one life, one liver. Namaskar.